Hey, Scott or Jason, can I ask you a quick question?
Yeah, I got lots of people listening to you, so
keep it clean.
Well, I hopefully remember that. This was kind of an individual teacher login thing, not necessarily a collective staff thing, correct? Like,
yeah, teachers can't do it in their classroom.
okay, that's what I wanted to make sure. That's what I told. That was the directive I gave my staff, was let them log in from their classrooms, but I didn't know all the, maybe didn't have enough spots, but okay.
Yeah, I got lots of people listening to this, so
Well, I hopefully know that. This was kind of an individual teacher login thing, not necessarily a collective staff thing, correct? Like,
yeah, teachers can't do it in their classroom.
okay, that's what I wanted to make sure. That's what I told. That was the directive I gave my staff, was let them log in from their.
Us in here.
Yeah, that's fine.
Okay.
Log in. Anything? Chat.
Why would they make
Watch that meeting hall thing. Okay, they cannot unmute themselves, so.
You went Zoom?
Pardon me?
You did Zoom?
Yeah. Did you show the calendar link? Do you have the calendar link?
Yep. Just making sure I was on there.
So, I got the credit cards on. So we still have quite a few people joining us. So I'm just going to watch out for another minute or so, and then we'll get started. Okay, well, we're going to go and get started. I'm sure there'll be a few more people joining us over the next 5 to 10 minutes or so, but I definitely want to get rolling so you guys can get on to other things that you have going. I know it's a really busy time of year for everybody right now, and just appreciate you taking a few minutes for us to go through and talk about where we are with our reopening plan, how things are going, at least at the district level, and then probably the part that mostly folks are interested in, talk about the memo regarding employee pay that we sent out on Friday. So before I get into the employee pay section though, let me just go through and share some information with you about where we are with COVID and just how things are going with school reopening. Most of this is information I shared with the school board a week ago. I did update a few slides in it specifically for our teachers. So first of all, this as of noon today, from the start of the school year until now, we've had 111 students that have reported that they have tested positive, 75 staff members. And you can see, just like we anticipated, much higher numbers at the secondary level than at the elementary level. So 31 elementary students district-wide since the start of school, and 80 secondary students since the start of school. When we get to the staffing numbers, those numbers start to balance out a little more closely, which isn't, again, a huge surprise to me, but 20 staff members at the elementary level so far, 9 at the middle school, 20 at the high school, and then 23 that are assigned This isn't district office, but people that have district-wide assignments. And so that includes people like transportation, child nutrition, special services, just people that work in multiple schools and are not assigned to a specific school. So all in all, it's certainly been busy. There's certainly an impact for every one of these individuals that gets confirmed as a positive case, and we have to go through the process to identify people that have to quarantine as a result of that. But all in all, things are really going, I think, very well. And if we're looking at that in terms of percentages, 111 is going to be right around 1% of our students so far have tested positive, and 75 is going to be around 5% of our staff members. So then this is basically just the same information in a chart format. You can see on basically a day-to-day basis how many staff and students we're seeing. So again, these are the number of positive cases reported on any specific day. Students are marked in blue, staff are marked in orange, and probably the key trend that we've seen that's the most concerning is the ratio of staff members compared to students that we've seen over the last week or just over a week. And the reason why that's such a concern is that's really starting to impact us operationally. So we've had a lot of challenges, for example, with transportation. We've had to cancel bus routes. Had 1 week where I actually had to cancel or suspend secondary busing for several days. We were gradually able to re-add those routes back in. But those are some of the things that have been a challenge for us. I'm broadcasting on YouTube. I need to resume my recording, so let me hit record on that. Okay, Jason just reminded me to make sure I'm recording this as well. So
Colby put that in the chat.
Thanks, Colby. Okay, so same thing, child nutrition, as we get outbreaks in child nutrition, that has an impact on our ability to operate child nutrition. With teachers, we're certainly seeing the impact on our substitute pool. We have not been able to cover all the absences from teachers, and I really appreciate those of you that have been able and willing to spend your prep time or your instructional time covering other teachers' classes. And we'll talk a little bit about that as well, but that's been exceptionally helpful in us being able to keep our schools open and running. So, and then this chart again, fairly similar to the same information. The previous chart was just showing on a day-to-day basis how many positive cases we've had reported. This chart is showing how many people are actively diagnosed with COVID, which is basically that 14-day period from their symptom onset until, or actually 2 days before their symptom onset and 14 days after that. So here's our trend line with students in blue. You can see we had a pretty good spike in that up until the first week of October, and then there's been actually a surprising decline in the number of students. At the same time, we've seen our staff numbers start to increase. And maybe a key thing to know is this isn't really a decrease in that number. This is where we're sitting as of today. And then the reason this number is going down is because we're not to tomorrow yet. So as we get our new cases tomorrow, then you'll start to see that these are just tailing off because it's projecting 14 days into the future. So, and then the lines back behind it are the number of students that have been quarantined as a result of close contact with either staff or students. And then down here in the orange, you've got the number of staff that have been quarantined. So again, I certainly know that this has had an impact on our teachers. Creates a lot of additional work for our teachers to now deliver blended instruction to these students who are at home because of that quarantine. We've had a lot of discussions about the quarantining, had really good survey results back on that, and still feel like that's a really important strategy for us to try to slow down the spread of the disease in our school district. So key takeaways, and this is actually what I shared with the parents 2 weeks ago. Probably the most challenging situation we see are when people are not keeping their symptomatic children home until after they see a medical provider, until after they get a negative test. And so it hasn't happened frequently, but when it does happen, when we've had students who have come back after being symptomatic, some of them have even gone to see a medical provider and have gotten a test, but then because they started feeling better, they came back to school before they ever got their results. And when their results come in, they're positive, and they're still in their infectious period, which now means every student that they're at school with that day has to quarantine for the next 7 days. or if people would really make a concerted effort to keep their children home until they see a medical provider and that medical provider tells them it's not COVID, or until they get results back from a COVID test that tells them it's negative, they would just wait until that time. It really minimizes the number of days that everybody else around them has to quarantine. And so it's something I've tried to message out, but I know that messaging from teachers sometimes can be more effective and more personal than it ever comes from the superintendent. So if you ever have an opportunity to talk with parents, if you ever get questions about, hey, my child's symptomatic, what should I do? The answer is take them to a doctor if you can. Have the doctor tell you whether or not it's COVID, and if it's not, they can come back 24 hours after their symptoms are gone. But if the doctor has concerns, they really need to go get that test, and then they can come back following a negative test from that doctor's results. But they can't, but ignoring that really puts everybody else around them at significant risk. And again, these are really the key symptoms that people should be looking for: fevers, persistent cough, difficulty breathing, loss of taste or smell. Those are like the big ones that people really need to be very careful and not bring their children back until they've done one of those two things. Okay, so with that, just a couple of things I want to talk about that could be changes to our reopening plan. So I really appreciate the feedback that we received from our teachers on the survey and from our families. We've had lots of good discussions, both district leadership wise with principals and with the school board about that survey results. But there is a pretty significant change that happened in the last 2 weeks from Eastern Idaho Public Health that's going to necessitate us going back and taking a look at our reopening plan, and specifically phase 3 of our reopening plan. So 2 weeks ago, the board for Eastern Idaho Public Health met, and they made some changes to their reopening plan, or to their COVID response plan. The first key change is they moved the definition for, or the categorization for, high-risk counties back down to 30 active cases per 10,000 people. So historically, that was originally set at 25 active cases per 10,000 people. They met in somewhere around early September. They changed that to a rate of 50 per 10,000. And that was based on really a regional rate. And then 2 weeks ago, they changed it back down to 30 and put it at the county rate. And that matters a lot because in Bonneville County, we've been up in the mid about 25 to 27 per 10,000 rate. So Madison is driving the regional rate up, but at Bonneville, we're not a whole lot below that. So our margin for phase 3 has really shrunk since they made that change. But the other key change that they made is that they eliminated any additional restrictions. So basically the restrictions that they had in their plan between phase 2 and phase 3 are now gone. And we are looking at the same restrictions in the high risk category as we are in the moderate risk. So the two key things that impact that is previously in their plan, they had said you cannot have group sizes of more than 50 people, and that's now gone. So we're still back at just the 28 square foot per person rule. They also had in there a statement that youth and adult sports activities should be discontinued, and that's now gone. Things like, and this one doesn't necessarily impact us, but things like hospitals suspending non-essential surgeries are gone. So all those additional restrictions they had in place are gone. And really all that high risk definition is it's supposed to be a red flag to say, hey, you really, if you haven't been paying attention to what we've asked you to do yet, you really should start paying attention to it. But there's really no more restrictions. So that matters a lot to us as a school district because our phased plan for high risk was to go to alternating days with students grouped by alphabet. So in this situation, if we implement this, then teachers will be teaching half of your students face-to-face with half of your kids at home online, and then basically flip-flopping those after 2 days in the week. So this is pretty similar to what District 91 started doing a few weeks ago. I honestly haven't heard from a lot of people how it's going over there. They just did it at the secondary levels. And the whole intent of it is to maximize physical distancing. So again, in our plan, We have the alternating days currently in our approved plan, and then the restriction on activities as well. And this will have a huge impact on all of the activities that we do as a district if we keep these in. But again, understanding that public health has eliminated those expectations from their plan. So that's where we've got to spend some time as a district leadership team talking. And when I say district leadership, it's both us here at the table, our directors, our principals. And then we ask our principals to go back and have conversations with their leadership teams, and the leadership teams to go back and have conversations with their grade level or subject area teams. So through the PLC process, we feel like we have the right ways for teachers to express their concerns and to let those come up to us as we make decisions at the district level. So we'd really ask our teams to start talking about what you feel that how you feel like it would go if we were to go to that alternating day schedule. Is there still a reason to go to that? Do we feel like there are significant benefits to it? Or are the challenges far outweighing the benefits? And really at this point, the only benefit that I see is it does create the opportunity for more physical distancing within our classrooms, within our cafeterias, within our hallways. But there's not a lot of benefit outside of that. And with the high level of compliance that I've seen in our classrooms when I visited with kids wearing masks, I'm just not sure that the benefit is there for this. So just know we'll be talking again with principals about this. We'll be asking principals to talk with leadership teams, and leadership teams to be talking with grade level teams and subject area teams about what does this look like. And we'll really have to have some input for the school board over the next couple of weeks. Because I think it's going to be sooner than later that Bonneville County is designated as a high risk. So we'll be sending out just a quick 1-question survey to all teachers to answer this. And that survey will be helpful, but honestly, what would be more helpful is that discussion that you have with your teams over the next couple of weeks. So with that then, just a couple of things from that survey that we got back. Both families and staff members gave us good grades on safely reopening schools. And I just want to tell, again, our teachers, our principals, how much I appreciate the collaborative work that's gone into reopening our schools safely for everybody. This grade doesn't happen simply because we have a nice, pretty 50-page plan. This page happens because people are doing the right work in the classrooms with their kids in the schools to make people feel safe. So I really appreciate everything you've done to help that and to follow the things we've asked people to do. And again, I thought this one was super encouraging. 58% of our families said that they felt about the same level of concern about their kids coming back to school face-to-face, and 36% felt better after a month. And so just a huge kudos to our teachers for helping kids feel safe and connected and cared for in our classrooms. And then this slide is important just as we get into the discussion about the pay, the additional pay that will be coming to our teachers. 2 key questions we asked our staff. What's your level of risk compared to past years? What's your level of hardship compared to past year? And again, just about half, just under half said that there was higher risk and more hardship than past years. There was about another 20% that felt it was significantly more, and then some that felt like it was about the same level as past years. And then just a few brave souls said that it's actually less hard than past years. So I have no idea what people have those jobs that it's less hard, but congratulations if you're one of those, and you must be doing something awesome that I can't figure out yet, because my job has definitely felt a little harder this year than past years. And then probably the one question that gave me some concern and pause is we asked people who have had their students quarantined what that experience has been like for their students. Really just on kind of 4 domains of learning. So clear directions from the teacher, the delivery of instruction from teachers, the level of help and support from teachers, and the feedback on the work. And you can see that it's 20 to 25% felt like that was poor for their kids. About a third felt like it was okay for their kids. Again, somewhere between a quarter and 30% felt like it was good. And just under 20% felt like it was a great experience. So really kind of a mixed bag of how those experiences are for our kids. And I know it's a lot that we're asking from our teachers to do that, but I also have heard from some families that some kids are really, really struggling in these quarantines. And so somehow we need to work on our system to get better so that our kids are feeling much more supported and that they're able to continue their learning more effectively than what's happened to date. So So that brings us to the governor's COVID relief funds. The great news about this is that it is additional money that will be coming into our teachers and our staff's pockets, which is more than well deserved this year. I think it was just quite the way to start the year when we're told that we have to freeze teacher salaries and we have to expect teachers to do more and do things differently than they've ever done. That's certainly not the way that I would have wanted to start the year. So I'm certainly grateful that we do have additional funding from the state and from the federal government to help offset or at least recognize that additional work that our teachers are putting in. So I know there's some questions out there about the funding and I'm sure why we put together the plan we put together. So let me just explain the rules we have to play by for this. So first of all, there's a lot of inaccurate information that was put out right from the top levels of our state government when they announced this, that I would say I was really excited about it when I first heard it and thought there's some great things we can do. And then over the next 2 to 3 weeks, we continue to get more clarity and more rules telling us what we could and could not do with the funding. So the key things that really have governed the plan are, first of all, we have to spend every dime that we get from this COVID relief fund by December 30th, 2020. If we don't spend it, it goes back to the state, and then I'm not sure what the state does with it. So it's nothing that we can hold on to for future. It's something that we can hold on to help our fund balance, which has been diminishing every year for the last few years. We have to spend the money by December 30th. The second one is that whatever we spend the money on, it has to be directly related to costs that have been incurred directly from COVID-19. So we can't just go back and use it for any purpose that we want to. I'll just say as a quick example, we cannot go back and simply move teachers on the career ladder to where they would have moved to if the career ladder would not have been frozen. That's not a cost that was incurred directly, or wouldn't be a cost that would have been incurred directly from COVID-19. And then the second part of that is the only unbudgeted expenses are allowed. And so basically, every year, a guy builds a budget for the district. It's approved by the school board. And if we had budgeted for any item in there, then we cannot charge that item back to this. And so it has to be basically new unanticipated expenses due to COVID. So as we looked at that, I think our plan is very similar to really all the rest of the districts around us. We've created 3 big buckets for that funding. The biggest bucket by far, it's about 70% of the funding is for employee compensation. Then the second bucket is blended learning support, which is primarily purchasing additional Chromebooks so that we can get to 1-to-1 in the district. And then the third bucket, which is the smallest bucket of those 3, is just to help offset some of those additional costs, some of those unanticipated expenses that we've had as a result of COVID this year. So to explain how we're doing the teacher and the staff pay, it's helpful to recognize that really these kind of 2 broad categories of staffing that we have. As teachers, you're pretty familiar with this. Our school board, I really wanted to make sure they understood it. So we have certified staff, which again, teachers, counselors, pupil service staff like psychologists, speech language pathologists, our school nurse. Those are our school social workers. Those are really the main ones we have that are certified, and of course our principals and administrators. The terms of employee, and the other side of that is all of our classified staff. So just some key differences between these. Certified staff are always employed on a contract, which means you get a salary, and that salary is good for the term of that contract, which is always 190 days for our teachers. Our principals are somewhere between 210 and about 230 days on their contracts, versus classified staff are hourly. So they clock in, they clock out, and they get paid each hour. When it comes to the Fair Labor Standards Act, this means that anybody who's on a contract and has a salary is exempt from overtime. So it doesn't matter how many hours you work as a teacher, I work as a superintendent. The salary that I agree to in my contract is the salary that I get, and none of those extra hours count for overtime. And that's a really fundamental difference with what happens with our classified staff, and that is, if our classified staff works extra hours, they get paid for the extra hours. So every hour they work, they get paid for that over. they get paid for that hour. And if they work overtime more than 40 hours per week, they get paid time and a half. All that's governed by the Fair Labor Standards Act. So, I mean, I'm sure teachers are just like our administration. You're likely putting in 50, 60, maybe 70 hours a week. All those extra hours you don't get paid for. It's just what we do to do the best job we can with our responsibilities. So that really governs how we can structure pay. Anytime we have additional funding, that really governs how we can use that pay. The second thing we looked at when it comes to the hazard pay is the level of risk that are involved in every individual's jobs in the district. And what we did is we really said, let's look at a high risk category. And we really looked at teachers in the classroom and identified them as being at high risk and looked at everybody else who has similar responsibilities as far as the ability to physically distance from others, as well as the number of people you interact with on a daily basis, or that you're required to interact on a daily basis. And we identified that as high risk. And then we identified a couple of employees that have higher risk because they cannot physically distance based on their work situations. And those are really limited to bus aides and our personnel that are in our special education units. So not our general special education classrooms, which are pretty similar to our regular classrooms. But when we get into the medically fragile units, the autism units, those behavior units, there's really almost no opportunity to social distance, which we felt puts them at a higher risk or the highest risk compared to what a typical teacher encounters. And then there are some employees that have less risk than what our typical teachers do. And I put myself in this position that I do have the opportunity to physically distance most of the day. I'm typically 6 feet away from people. I have interactions with people on a daily basis, but it's not nearly the number of interactions that our teachers have. And so I just am not comfortable saying that I have the same level of risk that our teachers have. And so we do have a few positions that are moderate risk, but by and large, it's going to be probably 95 to 97% of our employees are going to find themselves in this high risk category. So with that, how we have defined the expenditures is, again, compensating our certified employees who do not qualify for extra pay based on the extra hours they work, compensating them for 5 hours per week for work that's performed basically from the start of their contract, and we're seeing the start of teacher's contract up until Christmas break, which is the time frame that's the only time frame that they will let us compensate for. So we looked at that and basically identified that an hour per day over those 75 days is the right number to compensate all of our certified staff for. And we would do that for some key responsibilities that will be in that contract, and I can show that to you here in a second. And then the second level was hazard pay. And again, this is for everybody, both classified and certified, and looking at an additional 75 cents an hour for everybody in the district that is in that high risk category, $1 per hour for people that are at the highest risk, and then 50 cents per hour for people that are at the lowest risk. And then you can see the money that we have budgeted to purchase enough Chromebooks to get to 1-to-1, which is basically 2,500 more Chromebooks than we had previously ordered, and then another just under $500,000 for our additional expenses. So just on the teacher pay side of things, I'll kind of walk through and let you see what that looks like. So 3 categories of teachers. So first one are R2 teachers, which would be somebody who's in their second year of teaching. P5, and if you're in the P5 category, you can have as many as 15 years of teaching. P5 plus 31 category are most experienced teachers. You could have as many as, that's just an example. You could actually probably have more than this, but even 35 years of experience. So the first thing I want to point out is in our master agreement, this is the pay increase that these employees received through the master agreement. So people in R2 received a $1,500 pay increase based on the state raising the minimum teacher salary to $40,000. So they received $1,500. Everybody else who was not in R1, R2, or R3 only received a $500, and that was a one-time payment. It wasn't really an adjustment to your salary placement, but it was just a $500 one-time payment. So That is one key thing we wanted to emphasize, is that there is a group of teachers who, through the state law, had $1,000 higher increase to their salaries than most of our teachers did. So for all three groups, they would receive $468 in hazard pay, and that's based on the 75 cents an hour for 8 hours a day for 75 days. And then the extra duty pay is based on your hourly rate, which is based on what your salary is. So again, the number of hours are the same, but in R2, because you're at the start of the salary schedule, that would be $2,122 in extra pay. If you're somewhere in that 15 years of experience, that number is going to go up to $2,590. If you're all the way at the top end of the salary schedule based on your hourly rate, it's going to be just over $3,100. And then you can see what the total compensation is for those three categories. So again, those are just three examples. You can look in iVisions and see exactly what your placement is, what your hour, I think it shows your hourly rate. It shows your hourly rate. And so you can just calculate your hourly rate times 8 hours, or sorry, times 75 hours, and that will give you how much money you'll be eligible for with extra duty. So really the only other thing I think that we want to talk about is that there will be a work agreement that's sent to teachers. And really what we try to do is just identify those things that our teachers are typically already having to do as a result of coronavirus. So the number one thing we put on there is contacting families and students who are quarantined to help and support them with their learning. A second key responsibility is performing the contact tracing, so we can identify students who have to be quarantined as a result of being in close contact. And the challenging thing is sometimes that happens on Saturdays, sometimes it happens on Sundays. Sometimes we get that notification at 5 or 6 o'clock at night, and we have to notify those families to not bring their children the next day. So it is going to be something that a lot of times may be done during the school day, but a lot of times that's going to have to be done after school. And then we just recognize that trying to provide blended learning is going to take additional time beyond what's in our typical school day and what we typically work. And that's why we've identified that extra hour a day for compensation for our teachers and our certified staff. So that's really what I had to present, and basically just wanted to open up to questions. If you have questions. Oh, so the when. So thanks, Jason. So we will, you should be getting an email next week. I think a week from today is what we decided. So next Monday should be a good day where it's a non-instructional day for elementary. And you'll get the email that has, just like you do with your regular contract, where you'll go into iVisions and just check the box that you're accepting that work agreement for the additional pay. And then the pay will come on the November 20th paycheck. So all of that, all those lump sums will come together for all of our teachers with their November paycheck. So
You want to talk about the reason for the auditors and the plan that we have, and just
yeah, and that's helpful. So Jason's reminding me. So one key thing to know is we never get blank checks in the school district, and so there's always regulations that we have to follow, and there are audits that we have to comply with. And so we have talked through the plan with our auditors, and there's some key things in there that I think are important. So on the hazard pay, for example, there's some cautions against doing blanket checks for hazard pay for everybody in the district. And I'll just say I had a hard time with that as a district leadership team. I think we struggled with that because we felt that all of our employees are at risk when we open up our doors for face-to-face instruction. But to help comply with that idea that it shouldn't just be a blank check for everybody, that's why we felt like it was critical that we would identify the different categories and really differentiate pay based on the risk levels that are involved with that. And then the same thing with the extra duty, again, coming back to that we have to really document that these are additional costs related to COVID. So that work responsibility agreement that you are accepting documents the fact that you're getting paid for things that are new responsibilities that are coming about because of our plan to reopen schools in the face of COVID, not just simply restoring pay that was withheld by the state this year. So So with that, I think we've got our chat window open and we'll start taking questions. So Glenn, if you have questions, please use the chat menu to type those and we'll answer them.
If it can come in a different check, that's been the question.
So
Do that
a
to
different,
me,
yeah,
it'd be huge.
yeah. So unfortunately, we cannot do this as a different check. I know, I'll just say, I thought about that question myself because my paycheck goes to my wife and I never see it. So I was really hoping I could separate this out and get my couple of thousand differently, but it's a lot on our payroll just to process these two different payments. And so this will need to come in the same check. So you do have the opportunity through iVisions that you can designate a separate, or you can designate up to 2 different direct deposit checks. So if you only have one direct deposit set up, you can go in and set up a direct deposit to a different account. You could designate the amount you would want to go there. You would just want to make sure that you change that back after the fact.
And we're not doing it through iVisions, we're doing it in person because of some security things.
Oh, okay.
So they need to come in.
So they would need to submit that again, but I'd just be really careful because again, this is a significant burden on our payroll department just to get the payments processed. And so unless you really, really have to do that, I would think about other ways to try to separate that money. But when it comes to your taxes, it's all going to come due on April 15th anyway. So really separating it it helps up front, but you'll always pay for that by April 15th.
You said eligible for in regard to the extra duty pay. Does that mean that we might qualify for it or do we all qualify?
Everybody qualifies. So yeah, you want to read that just a little bit louder, make sure they can hear.
The question was, you said eligible for in regard to the extra duty pay. Does that mean that we might qualify for it or do we all qualify?
So all certified staff will qualify as long as you accept the agreement to perform those additional responsibilities. If teachers do not accept that agreement or certified staff don't accept that agreement, that's the only thing that would impact your eligibility. And I'll just say, and I hate to say things this way, but the reality is those are extra responsibilities that likely your principal's going to direct you to do anyway. You might as well check the box and get paid to do them.
Some of us are getting fall sports stipends as well. Are those going to be on the check too?
Yeah. Fall sports stipends will be on the same check, as well as prep buyouts for teachers that have had to sell their prep periods this trimester.
And then a question, it's not necessarily about COVID pay, but have you heard anything about the money coming from the state for master premium work?
No, we have not.
And then where in iVisions can we accept the agreement?
So you will see, it'll be under your contracts, but you'll get an email on Monday, and that email will have the clear directions on how to log in and to accept it. But it will be just like your contract was before. So it'll be that contracts portion. That's it. So I'm going to hang out for a bit. If you don't have any other questions, you're welcome to log off. But I just want to say before people start jumping off again, just how much we appreciate what you're doing out there on the front lines with our kids. I know it's a tough year. I know the more kids that go out, the harder it is for our teachers. And I just really appreciate everybody who stepped up and done all you can to make that a positive experience for your kids and to keep them engaged in their learning. It's by no means perfect, but you're doing just a terrific job with keeping things going. And I can't express my gratitude enough for that. But we'll just stay on and answer questions. But if you don't have questions, feel free to log off and go take care of whatever you need to.
Let's see. Our CNA students are required to wear face shields for their clinical. Is this something we could purchase with COVID funding?
I think we have.
We already did.
Well, the state provided some face shields, and I think so. The short answer is yes. The longer answer is I think the state provided some, and we will reach out to Gordon to see if we ever picked ours up. I'm not sure we ever picked ours up because we didn't see what the purpose for them would be. But we should be able to get our hands on some for you. So we'll make a note to talk to Gordon about that.
So my understanding correctly, classified staff will also get some reimbursement?
Classified staff, that's a great question. So classified staff will get hazard pay. And then the other thing with classified staff is you are eligible for extra hours and potentially overtime, depending on your work responsibilities. So that really should come from your supervisor, whether that's your principal or a district level director, that is asking you to perform additional responsibilities, and then you would get extra pay just like our teachers are. But that it has to be, for this money, it's got to be in response to something to do with COVID.
The face masks, John and Gordon both said the face masks have been picked up and are in the warehouse.
So if you would just send an email to, I'd say to both Gordon Howard and John Pym and tell them how many you need, then we can get those to them.
When can we expect to see Chromebooks in the classrooms that were ordered?
So we got a notification from Dell. Gordon reported today that they have some that have shipped already. We'll be talking with our elementary principals tomorrow on the organization of those. And the reality is, with about 5,000 Chromebooks coming in, we can't warehouse them. So they'll be turned around fairly quickly. But the intent is that by about the first or second week of second trimester, so the 1st of December, we should have, if Dell could deliver on their promise, we should have all the Chromebooks in our schools.
Are the behavior support being counted in the high risk category?
If they're assigned to a special unit, then they would be. So it's really just depends if they're assigned to those special units or not.
Is there any news about state funding and professional endorsements being approved for teachers who are on the R3 rung and are now on the PR3 rung for this year?
Yeah, so November quote.
That was for the CTE. I think that anytime we might start hearing that we've got October upload.
Okay.
So I pulled reports this afternoon and it's not showing any professional endorsement.
Okay. So we just completed our first IC upload of the year. That was due last Friday. Again, our staff just did a heck of a job of getting all that together. That first upload is just an incredible amount of work. And so now that the state has that data, they should start working on the professional endorsements. And as soon as we get confirmation from them, then we'll be notifying you of the change in your contract. But my guess is it's still going to be at least 3 to 4 weeks before the state has time to process all that data and get us our reports back.
I tell them the same thing for the.
And the same thing for career, for those of you that have occupational specialist degrees, it's really the same answer. The first step is for us to get our data up to them so they know who's teaching for us and all the data that's associated with that. And then they'll be working on their side to identify both people with a professional endorsement as well as those with occupational specialist degrees and relevant past work experience to adjust their placement.
And those CTE ones specifically will be into the first part of December at the earliest, because they won't take any action on those until after our November upload to IC.
You mentioned a survey about our opinion on teaching half of our classes 2 days a week, phase 3 plan. When will we see that survey?
So I think it's gonna be a 1-question survey. And so it'd be within the next day or two, and it'll go to both text message and your emails.
Thanks for this question, Ryan. What is the airspeed velocity of an unladen swallow? It's rhetorical. He says, thanks for all you're doing at the district level to help us educate our kids safely. Are the Chromebooks for students able to be taken home for Mondays and for when they are quarantined?
Yeah, absolutely. And that's why we're excited. So Steve Dewey asked about Chromebooks. That's why we're so excited to get to 1-to-1, is it finally makes it feasible that kids can take a Chromebook home with them when they have to quarantine, or on Mondays or other days you may have to designate as online learning days. So really that 1-to-1 deployment is going to be a huge turning point for us as a district to make it more seamless for kids to continue learning at home.
And then Shirley asked about what about the 1-to-1 pairs who are working, sitting close to their assigned students as relates to hazard pay?
Yeah, it's possible. That would really be up to special services to identify those individuals and get that information to us. Erica, will we stay 1-to-1? Yeah, so our intent now that we've reached that 1-to-1 threshold is that we would move into a rotation phase where we're essentially replacing 1,000 elementary Chromebooks on a 7-year cycle. So 1,000 for elementary and then probably 1,000 at the elementary level every year. So at this point, we really just have to buy 2,000 Chromebooks a year to sustain 1-to-1, and that's our intent. So Emily Juckett asked, will we be issuing Chromebooks to each student? How we handle them once they're here? Can we start to plan that kids can touch a computer daily in our classes if needed, or will we still be sharing them between teachers? So right now, at the elementary level, the idea is that every teacher would have a lab in their classroom, and that works well at the elementary level. And I don't know if Kim Williams is on. Kim Williams sent me an email wondering if we could do the same thing at the secondary level. And I'll just briefly talk about why we can't do a lab per teacher at the secondary. Well, why it would be so much more expensive for us to do a lab at the secondary level for every teacher versus kids having their own. There's really 3 things that work against teachers having their own labs at the secondary level. The first one is prep time. So as soon as you have built in a prep hour, that means that 1/6 of your Chromebooks are out of commission every hour. So you already have to buy 1/6 as many Chromebooks, which I think is about 18% more Chromebooks just to address the prep hour issue. The second thing is that you now have to provide Chromebooks at the level of the highest number of kids in the teacher's class. So you could have 36 kids in one class and 22 in another, and we have to provide 36 across the board in every class to make sure that the teacher has enough for their biggest class size. So that's going to necessitate probably another 15 to 20% more Chromebooks to address that. And then the third one is kids have to have Chromebooks to take home with them. That's a key aspect of this. And so now you also have to have a supply of Chromebooks to go home with kids, and teachers couldn't afford to lose those out of their classrooms because they may only be missing a kid out of 1 hour and not the rest of their hours. So all 3 of those things really work against that model for the secondary level. So the most cost-effective solution at the secondary level is to issue them to individual students and expect them to have them with them both at school and at home.
That's it.
Great questions from everybody. So appreciate you getting those to us. If anybody else has some, feel free to send them to us in the chat menu.